Hi everyone, this is Dr. Jof, and if you know someone with hip arthritis, today is the day where we talk about hip arthritis. One of the things that happens very early arthritis in young people is what we call AVN, or a vascular necrosis of the hip. That's what we're going to be talking about today. So we have a patient. B is from Manila. She told me that she has severe AVN on both hips, and she's asking me if we can have two hip replacements done at the same time. Now, for those of you that don't know what a vascular necrosis of the hip is, it's actually a bone dying from some condition. It could be a blood disorder or some medical condition like cancer, or it can happen because of smoking or alcoholism. So this is a hip bone, that's a ball and socket joint, and you can see it die. That is what AVN is. Now, this is a normal x-ray on one side compared with a vascular necrosis of the hips on both left and right on the other side. So when you have a normal hip joint, the joint, especially the femur head, is very round. That's what the arrow is pointing at, compared to the x-ray of arthritis from a vascular necrosis. You see a severely deformed head on both sides. Now, we are going to do usually a hip replacement when the arthritis and pain is very severe, and this is called a total hip replacement. We remove the ball and the socket part of the hip joint and replace it with implants so that the patient can be walking as early as a few hours after surgery, and in other countries it's already being done as an outpatient basis. Now, for B, the quick answer is yes, you can have two hips at the same time, but you will always need to ask your surgeon what his preference is. You may have surgeons who would like one hip at a time, so that when you have a strong hip now on one side, then you can proceed to the other hip. Others will want both sides done because the pain is so severe. You can also take a look at the medical condition of the patient. If the patient is very strong, perhaps you can do two at the same time. So this is a patient where we did two hips together, and yan ang sagot ni Dr. Jof. You have to decide this with your doctor. Every patient and every doctor is different. The pros and cons need to be discussed. I hope this answers your question, Ma'am B. I hope to see you in the future. This is Dr. Jof. You can find me here in Robinson Cybergate. Much love and respect.